Today we are going to be going over how to properly recognize and treat exertional heat illnesses. As you see here, we have an athlete go down during practice. When initially evaluating the athlete, you should look for signs and symptoms of exertional heat illness, which includes dizziness, pale skin, lightheadedness, staggering, major cognitive or behavior changes, confusion, syncope, hot and wet skin, and vomiting. To determine if the athlete is experiencing heat syncope, heat exhaustion, or heat stroke, you should first move the athlete to a cool shaded area, remove any excess equipment or clothing, elevate the legs, and provide oral hydration. If the athlete does not improve in this position, heat syncope can be ruled out and a rectal temperature should be taken. The major differences between heat exhaustion and heat stroke are heat stroke presents with CNS dysfunction and a rectal temperature of 105 degrees Fahrenheit or greater. To take a rectal temperature, you have to first set up the thermometer. First, you must take the probe out of the case and attach it to the thermometer. Then turn on the thermometer and make sure it works. Once the thermometer is set up, drape the athlete to ensure privacy and have the athlete lay on their side with their top knee and hip flexed. Clean and lubricate the probe and insert the probe 4 inches, and use tape to keep the extra wire in place as the thermometer will remain in place for the duration of treatment. Rectal temperature should be read every 5 minutes. Once a rectal temperature is read, the diagnosis of heat exhaustion or heat stroke can be made. If the patient has a rectal temperature of 105 or greater, rapid cooling is necessary. The gold standard for rapid cooling is cold water immersion in a cold tub. When using a cold tub, the athlete should be immersed up to their neck in circulating water that is between 35 and 59 degrees Fahrenheit. Once an athlete's core temperature goes below 102 degrees, they can be transported to the hospital for further evaluation and treatment. When a cold tub is not available, the taco method can be used. For the taco method, you will need the assistance of at least 5 other people. The athlete is placed on top of the tarp, everyone lifts a side of the tarp, and one person wraps a towel around the athlete under their armpits to ensure the athlete's head stays above water. Cold water is then added into the tarp, ideally to the chest level of the athlete. The people holding the tarp then begin shaking the tarp to help circulate the cold water. Once an athlete's temperature goes below 102 degrees Fahrenheit, they can be transported to the hospital for further evaluation and treatment.